Dust mites are more than merely creepy. For some people, these microscopic creatures pose health risks. They can cause allergic reactions and can increase snoring. At the Mount Sinai Hospital Center in Montreal, Dr. Mark Baltzan is a sleep specialist. His research touches on everything having to do with sleep, from dust mites to snoring to allergies.
When people have dust mite allergies and they're snoring, we could show them anti-dust mite measures, including a special cover for the pillowcases that then cuts down the dust mites, cuts down the allergy, and they sleep without snoring. Dust mites are inside. And
Dr. Baltzan and his fellow scientists are still asking some of the most basic questions about sleep, like, why do we sleep at all?
That is hard to actually answer scientifically. There's good reasons why we would want to sleep, because it's uncomfortable to feel sleepy. We also probably need to sleep for cellular repair at the level of DNA and maybe of the cell membranes. Experiments have been done on rats, depriving them entirely of any sleep, and eventually they all die. It's not clear why they die when an autopsy is done, but they develop a fever, they eat and lose weight, and eventually become disorganized, and then their heart stops.
Getting enough sleep? If you are, you're lucky. There are more than 100 sleep disorders out there, and millions of people have them. Some people sleepwalk, others hardly sleep at all. For many, the night is full of problems. With most of his patients, Dr. Baltzan examines brainwaves to see whether the sleep disorder is physical or psychological. And the solution is often far from easy.
Sleep disorders are very common, and it was the reason why I fell in love with sleep medicine. I believed it was ignored when I was young. For example, 9% of North Americans have chronic insomnia. That's 6 months at least of insomnia, and that's not a few people.
One of the most common problems that people have when they sleep is snoring.
Approximately half of men snore, and 1/4 of women snore, but nobody talks about that because it's considered not beautiful or actually impolite to tell a woman that she snores. Snoring comes from a narrowing of the breathing passages, either in the nose, the throat, or further down. The air passes through this narrow passage, which then vibrates and makes sound. Snoring is usually not a problem for somebody who is sleeping. They're unconscious, and they're usually oblivious. The problem is for the people around, the bed partner, people who go camping with them, people who have to share a hotel room. And as a physician, I end up doing couple therapy because the snoring is the reason they come to see me, but they're angry with each other about other things, and the snoring is a big excuse.